Corrections Officer, members of the media, good afternoon. Thank you for attending this launch of our progress report as it relates to health. We're here this afternoon to talk about our progress report as it relates to the health system in Bermuda. One of the things I wish to say as Minister is that certainly as the Minister of Health, who has a Premier who is also a physician, who brings an infectious energy and enthusiasm and commitment to building healthcare in this country, together with my commitment and dedication to this new role of health, I think we have a winning partnership. Clearly, what we are talking about in this island is modernization processes which have been going on since 1998. I believe it is fair to say that the coming into power of the Progressive Labour Party, the PLP, has coincided with the modernization drives that are taking place in our island. As you look about this country, infrastructure growth, technology growth, construction growth are all of the pieces of evidence of our modernization. I believe it's the reason why we branded ourselves as presiding over the new Bermuda. The building of a new healthcare system has been a full participant in this modernization process. And today we outlined in the progress report some, not all, but some of the details of the modernization process. It was an exercise and a process which was begun by my predecessor, the Honourable Patrice Miners, who is here on the podium with me. It was also undertaken and managed by the Acting Minister of Health, Senator the Honourable Philip Parenshift, the current Attorney General, and by the Honourable Nelson Baskin, former Minister of Health. So we're excited to be talking about the progress which health has been making in this country. The master plan speaks to the very issues of the construction and upgrading of our hospitals. The partnerships which Premier Brown has been encouraging with international world-class clinical care providers in Boston, including Leahy and Johns Hopkins and the Boston Partners, are important pieces to this puzzle and vision. It works this way. We are using our partnerships so that doctors of world-class clinical standards will be able to travel to our island and carry out procedures for Bermudian residents. This way we ensure that we offer global class clinical services and therapies to our population. It helps us to reduce the need for our residents to travel overseas, which drives up healthcare costs. One of the key features of the Premier's and my vision is, of course, to introduce partnerships and to reduce the impact of high healthcare costs in our island, so that we have not only an excellent healthcare system, but we have it accessible to everyone, not just the rich, but the needy as well. We've got many things to also feature as part of the healthcare system build-out that we're building, so that when we build a new bricks and mortar acute care center at the King Edward VII Hospital, we are introducing into it clinical services and clinical therapies that are at the highest possible standard, so that we're putting good wine into good wine skins. One of the things, before I hand over to my colleague, former Minister Miners, that I wish to emphasize as well is the commitment of the working staff within the hospital. One of the things that I have found is that, since being health minister, is that the the staff within the Bermuda Hospitals Board, both at our acute care unit in KEMH and our acute psychiatric unit at Maui. These dedicated, compassionate, caring individuals, Bermudians and guest workers alike, have long service records which are impressive, indicative of their commitment and their compassion and their love for the work and the relationships that they form with their clients within these facilities. And so we set out on a very bold new vision in healthcare, which is consistent with this modernization drive which is occurring in our country and over which the Progressive Labour Party has been lucky enough, blessed enough to both preside, control,